High blood pressure, also known as hypertension, is a common health condition that often goes unnoticed. Many people may not realize they have it until they experience symptoms or have their blood pressure checked during a routine visit. While mild elevations might not cause immediate harm, certain symptoms can signal a medical emergency. In this video, we'll explore which symptoms mean you should seek urgent care if you have high blood pressure reading. Understanding these warning signs can help you act quickly and potentially prevent serious complications. Let's start by understanding what high blood pressure is and why it matters. High blood pressure occurs when the force of blood against your artery walls is consistently too high. Over time, this increased pressure can damage your blood vessels and organs, leading to serious health issues. Most people with high blood pressure don't have obvious symptoms, which is why it's often called the silent killer. However, when blood pressure rises to dangerously high levels, your body may start to show signs that something is wrong. Recognizing these symptoms early is crucial for your health and safety. Symptoms related to high blood pressure are important because they can indicate that your body is under significant stress. Ignoring these warning signs can lead to life-threatening complications such as stroke, heart attack, or organ damage. It's essential to know which symptoms require immediate attention so you can seek help before things get worse. In the next scenes, we'll break down the specific symptoms that should prompt you to seek urgent care. One of the most common warning signs of dangerously high blood pressure is a severe headache. This isn't your typical tension headache. It's often sudden, intense, and may feel different from headaches you've had before. If you experience a severe headache along with a high blood pressure reading, it could be a sign of a hypertensive crisis. This situation requires immediate medical attention to prevent further complications. Another urgent symptom to watch for is sudden changes in your vision. This can include blurred vision, double vision, or even temporary loss of sight. High blood pressure can damage the blood vessels in your eyes, leading to these symptoms. If you notice any sudden vision changes, especially with a high blood pressure reading, it's important to seek urgent care right away. Chest pain or a feeling of pressure in your chest can be a sign that your heart is under stress due to high blood pressure. This symptom should never be ignored, as it may indicate a heart attack or other serious heart problem. If you experience chest pain along with a high blood pressure reading, call emergency services or go to the nearest urgent care center immediately. Shortness of breath is another serious symptom that can occur with high blood pressure. This may happen because your heart is struggling to pump blood effectively or because fluid is building up in your lungs. If you suddenly find it hard to breathe, especially if you also have a high blood pressure reading, seek urgent care as soon as possible. Sudden numbness or weakness, especially on one side of the body, can be a sign of a stroke caused by high blood pressure. This symptom may affect your face, arm, or leg. If you notice any sudden numbness or weakness, don't wait, call emergency services or go to urgent care immediately. Time is critical when it comes to treating strokes. Difficulty speaking or understanding speech can also be a sign of a stroke related to high blood pressure. You might suddenly have trouble finding words, slur your speech, or not understand what others are saying. These symptoms are medical emergencies and require immediate attention. Don't hesitate to seek urgent care if you or someone else experiences these signs. Confusion, trouble thinking clearly, or sudden memory problems can be another sign of a hypertensive emergency. High blood pressure can affect blood flow to your brain, leading to these symptoms. If you or someone you know suddenly seems confused or unable to think straight, especially with high blood pressure, seek urgent care immediately. Severe anxiety, panic, or a feeling of impending doom can sometimes occur with dangerously high blood pressure. While anxiety can have many causes, if it appears suddenly and is accompanied by other symptoms or a high blood pressure reading, it's best to err on the side of caution and seek urgent care. While nosebleeds are common and often harmless, a sudden, severe nosebleed along with a very high blood pressure reading can be a sign of a hypertensive crisis. If you experience a nosebleed that won't stop or is accompanied by other symptoms, seek urgent care right away. Seizures are rare but can occur if blood pressure becomes extremely high and affects the brain. If you or someone else experiences a seizure, especially with a known history of high blood pressure, call emergency services immediately. This is a life-threatening situation that requires urgent care. Sudden, severe back pain, especially between the shoulder blades, can sometimes be a sign of an aortic dissection, a tear in the major blood vessel coming from the heart. This is a rare but life-threatening complication of high blood pressure. If you experience this type of pain, seek emergency care immediately. Swelling in your legs, feet, or ankles can be a sign that your heart or kidneys are struggling due to high blood pressure. If this swelling comes on suddenly or is severe, it's important to seek medical attention quickly. This could indicate heart failure or kidney problems that need urgent care. Feeling extremely tired or weak for no clear reason can sometimes be a sign that your organs are not getting enough blood due to high blood pressure. If you experience sudden, unexplained fatigue along with a high blood pressure reading, it's best to get checked by a healthcare professional as soon as possible. Fainting or losing consciousness is a serious symptom that can be related to a sudden drop or spike in blood pressure. If you or someone else faints, especially with a history of high blood pressure, seek emergency care immediately. This could be a sign of a life-threatening problem. Sometimes, even without symptoms, extremely high blood pressure readings such as 180/120 mmHg or higher are considered a medical emergency. If you see numbers this high on your blood pressure monitor, it's important to seek urgent care even if you feel fine. Waiting for symptoms can be dangerous. Hypertensive crisis is a situation where blood pressure rises so high that it threatens your organs. This can be divided into two types: hypertensive urgency and hypertensive emergency. In a hypertensive emergency, you have very high blood pressure plus symptoms like chest pain, vision changes, or confusion. This requires immediate medical attention to prevent organ damage or death. Hypertensive urgency means your blood pressure is extremely high, but you don't have symptoms of organ damage. Hypertensive emergency means you have both very high blood pressure and symptoms like chest pain, shortness of breath, or neurological changes. Both situations require prompt medical attention, but emergencies are more serious and need immediate treatment. Acting quickly when you notice these symptoms can make a huge difference in your outcome. High blood pressure emergencies can lead to permanent organ damage or even death if not treated right away. The sooner you get medical help, the better your chances of recovery. Don't wait for symptoms to go away on their own. Urgent care is essential. Knowing how to check your blood pressure at home is important, especially if you have a history of hypertension. Use a reliable home blood pressure monitor and follow the instructions carefully. Keep a record of your readings and note any symptoms you experience. This information can help your healthcare provider make the best decisions for your care. If you experience any of the urgent symptoms we've discussed, such as chest pain, severe headache, vision changes, or sudden weakness, don't hesitate to call emergency services. Time is critical in these situations. Getting help quickly can save your life and prevent long-term complications. When you arrive at urgent care or the emergency room with high blood pressure symptoms, the medical team will quickly assess your condition. They may check your vital signs, run blood tests, and perform imaging studies to look for organ damage. Treatment will depend on your symptoms and how high your blood pressure is. Treatment for a hypertensive crisis usually involves medications to quickly lower your blood pressure. You may receive these medications through an IV or by mouth, depending on your condition. The goal is to reduce your blood pressure safely and prevent further organ damage. You may need to stay in the hospital for monitoring. After an urgent care visit for high blood pressure, follow-up care is essential. Your doctor may adjust your medications, recommend lifestyle changes, or order additional tests to check for organ damage. Keeping up with follow-up appointments can help you avoid future emergencies and keep your blood pressure under control. Making healthy lifestyle changes can help lower your blood pressure and reduce your risk of emergencies. This includes eating a balanced diet, exercising regularly, limiting salt and alcohol, and managing stress. Small changes can make a big difference over time and help you stay healthy. Taking your blood pressure medications exactly as prescribed is crucial. Skipping doses or stopping your medications suddenly can cause your blood pressure to spike and increase your risk of emergencies. If you have concerns about side effects or costs, talk to your healthcare provider for solutions. Even if you feel fine, it's important to monitor for symptoms of high blood pressure emergencies. Keep track of any new or unusual symptoms and check your blood pressure regularly. Early detection can help you get treatment before complications develop. Certain factors can increase your risk for high blood pressure emergencies, such as age, family history, obesity, and chronic conditions like diabetes or kidney disease. Knowing your risk factors can help you stay vigilant and take steps to protect your health. Regular checkups with your healthcare provider are key to managing high blood pressure. These visits allow your doctor to monitor your readings, adjust your treatment plan, and catch any problems early. Don't skip your appointments even if you feel well. Having an emergency action plan can help you respond quickly if you develop symptoms of a high blood pressure crisis. Know the nearest urgent care or emergency room, keep emergency numbers handy, and make sure your family knows what to do in case of an emergency. Educating your family about the symptoms of high blood pressure emergencies can help them act quickly if you need help. Share information about what to watch for and what steps to take if you develop urgent symptoms. Teamwork can save lives. It's easy to dismiss symptoms like headaches or fatigue, but when combined with high blood pressure, they can signal a serious problem. Trust your instincts. If something feels wrong, it's better to get checked out than to wait and risk complications. Older adults are at higher risk for high blood pressure emergencies. Symptoms may be more subtle or mistaken for other conditions. If you or a loved one is elderly and has high blood pressure, be extra vigilant for any changes in health or behavior. While rare, children can also experience high blood pressure emergencies. Symptoms may include headache, vision changes, or seizures. If a child with high blood pressure develops these symptoms, seek urgent care right away. Pregnant women with high blood pressure are at risk for complications like preeclampsia. Symptoms such as severe headache, vision changes, or swelling should be taken seriously. If you're pregnant and notice these symptoms, seek urgent care immediately. After receiving urgent care for high blood pressure, it's important to follow your doctor's instructions closely. Take all prescribed medications, attend follow-up appointments, and make recommended lifestyle changes. This will help you recover and reduce your risk of future emergencies. Stress can raise your blood pressure and increase your risk of emergencies. Practice stress management techniques like deep breathing, meditation, or gentle exercise. Taking care of your mental health is just as important as managing your physical health. Certain triggers can cause your blood pressure to spike, such as excessive salt intake, alcohol, or missing medications. Identify your personal triggers and work to avoid them. This can help keep your blood pressure stable and reduce your risk of emergencies. Stay informed about your condition by reading reliable health information and talking to your healthcare provider. The more you know about high blood pressure and its risks, the better prepared you'll be to manage your health and respond to emergencies. Having a support network can make managing high blood pressure easier. Family, friends, and support groups can provide encouragement and help you stay on track with your treatment plan. Don't hesitate to reach out for support when you need it. Let's quickly review the urgent symptoms that mean you should seek care. Severe headache, vision changes, chest pain, shortness of breath, numbness or weakness, difficulty speaking, confusion, severe anxiety, nosebleeds, seizures, severe back pain, swelling, unexplained fatigue, and loss of consciousness. Remember, high blood pressure readings of 180/120 mmHg or higher are also emergencies. Taking action at the first sign of trouble can save your life. Don't wait for symptoms to get worse. If you notice any of the warning signs we've discussed, seek urgent care right away. Early intervention is the key to preventing serious complications from high blood pressure. High blood pressure can be dangerous, especially when urgent symptoms appear. By knowing what to watch for and acting quickly, you can protect your health and avoid life-threatening complications. Remember to monitor your blood pressure, follow your treatment plan, and seek urgent care if you experience any of the symptoms we've discussed. Stay informed, stay prepared, and take care of your health.